To our top story, in youth living with HIV and AIDS in the country are calling upon the president to force the Kenya Medical Supplies Authority, KEMSA, to provide Septrin drugs that have been short in supply since March this year. KEMSA, which has until Tuesday, the 8th of September, to explain the failure to deliver drugs reportedly worth 1.2 billion shillings, is also entangled in a 7.6 billion shilling COVID-19 medical supplies procurement scandal. NTV's Seth Olale with a new KEMSA scam.
Barely a month after leaked documents from the Ministry of Health revealed that one of Kenya's leading medical supplies donor, Global Fund, had raised queries regarding accountability at Kenya Medical Supplies Authority that has affected various sponsored health programs in the country, KEMSA is yet again entangled in a fresh procurement scandal directly affecting at least 1 million people living with HIV AIDS in the country. Global Fund and USAID, which jointly inject medical supplies worth 400 billion shillings through a 3-year partnership with Kenya, have been the key donors in the fight against HIV and AIDS in the country. Bernard Adede, who is the National Prevention Ambassador for Youth Living with HIV and AIDS in Kenya, says the new KEMSA procurement scandal could deal the country a big blow.
If we continue with this direction, we are going to put our country in a bad image internationally. And if Global Fund withdraw support, for example, what we are going to have a lot of people who are suffering from HIV will suffer more than before.
Youth living with HIV AIDS in Kenya largely depend on the Septrin drugs to combat opportunistic infections alongside ARVs. In medical terms, they are in the first-line category of Septrin and ARVs dependence. Septrin has been out of public medical stores since April this year, despite the Ministry of Health authorizing KEMSA to procure the highly prioritized drugs worth 1.2 billion shillings in January. However, no delivery has been made to date, with the supplier expected to have made the last delivery in July this year.
If we have money and we cannot know where even the drugs are, what are we doing as a country? Who is going to fight for the rights of the young people living with HIV who cannot speak? Who is going to talk on behalf of someone in that village who cannot get meal from morning, lunchtime and evening, and the world is doing bad?
With Septrin out of stock in public health stores since April, dependents have been forced to purchase one tablet at 10 shillings from private hospitals.
Sometimes it might be there where now people will not think about that we have people with HIV in this country. And that is the real thing. And the most important thing that if you look at the statistic, most of the young people, age 15 to 24, are the ones who are struggling with the viral load.
Asked about the missing Septrin drugs, the Ministry of Health gave it a wide berth today.
Swala ya madawa za HIV ambapo haijafika NASCOP kutoka KEMSA, hayo mimi sina habari yake, lakini tunaweza kuichunguza hiyo alafu tukupatie hiyo report wakati ingine.
KEMSA has up to tomorrow, Tuesday the 8th September, to resolve the issue as pressure mounts on the Ministry of Health to reveal the identity of the supplier who was awarded the tender for Septrin drugs but has failed to deliver 9 months later. Seth Olale, NTV.